So I would like to talk a little bit about urinary tract infections in pregnancy. So this is also something which can be excruciatingly painful, and obviously is generally treated in Western medicine with antibiotics. So, if you do have a urinary tract infection, it can be quite serious because it can spread quite easily from the bladder up to the kidneys, and you really don't want to take any chances. So if you have a confirmed urinary tract infection, I would go ahead and take the antibiotics and make sure that you're taking a good course of acidophilus or probiotics following your antibiotics. So sometimes I do get people coming to see me because they're getting recurrent infections and they really just don't want to be taking all these antibiotics. I mean, nobody really wants to take them, especially if you're pregnant. So acupuncture, in acupuncture terms, it really comes down to sort of damp heat in the lower jiao again. So you may have heard about things like cranberry tablets, which people have reported to me they've had quite a good result with. So this is meant to sort of stop the bacteria sticking to the wall of the bladder. You also need to massively up your fluid intake. It's more common in pregnancy because your urethra, the entrance to your urethra, is basically slightly more relaxed because of all the hormones, and it's also can be quite often more open than it is normally because obviously you've got a big baby squashing on the top of your bladder. So they can be more common, but they are really deeply unpleasant. So acupuncture can really help to sort of prevent them from recurring. So if you have had one and you don't want to have another one, then I would definitely recommend that you go and get an acupuncture treatment as soon as possible and have a course of treatments and talk to your acupuncturist about diet as well. So you should be avoiding sort of certain foods which can aggravate it, but you don't have to suffer with them. You can have acupuncture to support you while you are taking other precautionary measures.